startling new report from the American Society of Health System Pharmacists and the University of Utah Drug Information Service reveals there are 323 active drug shortages in the U.S. This is an all-time high. Experts sounding the alarm on the lack of chemotherapy, emergency, and ADHD medications, among others. So there's even more. With more, we are joined by our Fox 11 medical contributor, board-certified emergency room doctor, Dr. Michael Daignault. Good to have you. This is our first installment of Ask the Doctor. We'll get to those questions from our viewers in a moment. But this drug shortage, why is this happening, and how concerning is this for patients and doctors?
I mean, it's really significant. We have multiple federal agencies looking at this right now, including HHS, FTC, even the White House. And I think there's two scenarios here. The first one is that the demand is outpacing the supply for some drugs like Ozempic and Wegovy, because a lot of the people that took them for diabetes are now finding it hard to get because people are taking them for weight loss and cosmetic reasons. And so the other scenario is that supply. And I think it's the middlemen, the companies that buy wholesale from the drug manufacturers. They're pushing for lower and lower drugs from the companies, and the companies are like, well, we're going to not produce as much because we're not making a profit. And so we're not getting a lot of the drugs that we need, especially in the emergency room, amoxicillin, drugs that we use for codes. So fortunately, we're not at the point where we've had to change any of our practices, but I fear that we're getting there shortly. And so we need to figure out what the actual cause and address it before it becomes an actual issue, especially in the ER.
Yeah, I mean, I know a lot of parents are concerned about, because of their kids, for ADHD.
Right.
That is a big issue. So what's your word to them?
Yeah, I mean, the best thing they can do is just really coordinate with the pediatricians and make sure they have a long enough supply for especially through the summer.
Okay. Well, we'll stay on top of that.
For sure.
So we kicked it off last week. We asked you for your questions to ask the doctor. So we have our first one tonight. This is from Carmen in Los Angeles. She says, recently, I heard about a full body MRI scan that is used for screening approximately 500 health conditions. It's called Prenuvo. It's pretty costly, but seems nice for those who are hypochondriacs or have a family history of cancer or certain chronic diseases. What is your opinion on a scan like this, as it is probably a lot of radiation? Do you consider it unnecessary?
Right, so Prenuvo with their whole body MRI costs upwards of $2,500. It's a game changer potentially for healthcare, but the first thing to remember, this MRI is not radiation. So it's a great question, but just remember MRI, not radiation, like CAT scan. Okay,
so that puts her at ease there.
Right, so that's one good thing. The second thing is that it shouldn't replace the screening test that we already do, and so that's the PSA test for prostate cancer, the colonoscopy for colorectal cancer, a whole body, just physician dermatologist looking at your skin, make sure you don't have skin cancer, and mammography for breast cancer. This shouldn't replace that. But I think as this becomes more prevalent, and the company itself is looking at ways to reduce the cost. And the biggest cost driver is the amount of time the patient spends in the MRI and then paying the radiologist to review the scan. So if they can make the scan happen faster, that'll reduce the cost. And also, AI could replace a lot of the radiology reads on these MRIs. They can do it faster and perhaps just as effectively. So I think once the cost starts coming down, you see insurance companies take notice. And then way down the line, you have to think about U.S. Preventative Task Force look at screening MRIs along with insurance companies and say, hey, this is a great way to save costs and, identify solid tumor cancers very early on, where the treatment would be less costly for patients, hospitals, and insurers.
Okay, well, there you go, Carmen. There's your answer.
Great question.
Yeah, let's take another question. This one is from Peng in Culver City. What are some good ways to prevent high cholesterol? I work out constantly, but recently faced a high cholesterol problem. Great question, Peng.
Yeah, so thank you, Peng, from Culver City for this. And so, cholesterol gets a bad rep, right? It has a negative connotation, but it's actually really important in how the body makes cells, vitamins, and hormones. And so a couple of take-home messages for people that are worried about their cholesterol. One, you got to look at what you're eating. And if you eat more oats, if you start eating more apples, avocado, oranges, that will help reduce your cholesterol. And when you go to your doctor, we always know about checking the LDL, which is the bad cholesterol, the HDL, which is the good cholesterol. Ask your doctor to check the ApoB. This is a really important test. This is the molecule that carries the bad cholesterol to our cells and through our blood. And ApoB represents that sticky cholesterol that is part of the plaque in our coronary arteries. And so you can have an abnormal cholesterol level, but your ApoB will be low, meaning that you're not at risk for coronary artery disease. So please ask your doctor to check the ApoB and then try to focus on your diet a little bit. But that's a really key point for people. ApoB. ApoB. It's a simple blood test.
Okay, got it. Well, if you want your question answered by Dr. Daignault, please send them to askthedoctor@fox.com. Include your name and city, but please no other personal information, and Dr. D will answer your question right here on Fox 11. Dr. D, that was great. Thank you so much.
Thank you.
All right, Alex, over to you.
All right, much more.